Hello dear viewers, and welcome to another episode of Daily Reset, where a new chapter of your life starts with us. And today we have a very interesting topic and a very interesting guest. But before that, how about we take a quick break and we'll be right back right after this, so stay in your seats. All right, dear viewers, and we're back again after that short break. And today we have a very interesting topic, and that is the daily oral habits. And today our guest is Dr. Abdullah Abul, and he's going to talk about it. But before that, how about we take a more understanding of who he is and what does he do. Hello and welcome to the show.
Hi, thank you for having me.
Welcome.
I'm glad to be here. My name is Dr. Abdullah Abul. I'm a senior specialist in endodontics. I teach and train in the Kuwait Advanced General Dentistry program, which is part of the Ministry of Health. I'm an endodontic specialist. I work for the government. I work in the private sector. So I've been doing endodontics for about now 16, 17 years. And dentistry for about 20 years.
That's amazing. That's a wonderful CV.
Yeah, thank you.
Yeah. So, daily oral habits. What are we talking about when it has to do with this? Let's take a general term so that the audience could understand it.
Well, if you should be talking about habits, we could split these into two categories actually. So we can say that we have dental habits, and we have dietary habits, which all affects the dental oral hygiene. It affects how teeth are staying inside the mouth and for how long are we having these teeth in our lives. So all these have a direct effect on teeth and the way we do them over life. So yeah, if we talk about, for example, dental habits, we're talking about flossing techniques, we're talking about brushing techniques, we're talking about the sequence of using when to use a floss, when to use a dental brush, and when to use a mouthwash, and especially like when you take a sugary food or acidic food, when to do your mouthwash or when to do brushing. So all these affect teeth actually, and affect how these teeth are healthy or not.
All right. So now we're going to break down everything you said. So let's start as usual in the morning. So usually there are morning habits that a person should do. And what are they? So let's start in the morning as usual.
For me, for example, I'm a dentist, so I should get this right, I hope. So usually what you do start with is flossing. A lot of people think that they should do brushing before doing flossing. Actually, by doing flossing before brushing your teeth is that you remove all these food debris and you remove all that plaque that is attaching on inside.
Kind of like loosening them up.
Yeah, so what you do is you loosen them up and then you start doing your brushing technique. So usually I recommend for any who wants to do to brush his teeth to use a medium or soft toothbrush and to stay and to keep brushing his teeth for about 2 minutes. And this is actually the effective time of which you can get all your teeth clean. So if you split this 2 minutes into 4 quadrants, so 30 seconds each quadrant, if you get your mouth split into 4 quadrants, so 30 seconds, 30 seconds, 30 seconds, 30 seconds. If you're a little bit lazy, you don't want to get this timed, you can get an electric toothbrush actually, which can help you and get timed into 4 quadrants. And after doing your brushing, your teeth brushing, you should wait about 20 to 30 minutes to get that fluoride effect inside your mouth, and then do your mouthwash if you feel like you need a mouthwash, because not everybody needs a mouthwash actually.
Actually, I wanted to ask you about that mouthwash. Is it something necessary or is it just something that is supplementary to brushing?
Well, for a healthy person, person who brushes his teeth 2 to 3 times a day, who flosses between his teeth, he doesn't need a mouthwash. But if you want to have a mouthwash, like to freshen up and to feel fresh and to have that nice breath, yes, of course, you can use a mouthwash. But there are some patients where mouthwash is prescribed for them as a cure, as a medicine for them.
Oh, so you mean like, for example, if someone has gum problems?
Of course. So someone who has a gum problem or who has a fungal infection inside his mouth, we prescribe for them a mouthwash. But for a healthy person who brushes his teeth and uses a toothbrush, mouthwash is, as you said before, is a supplementary.
Oh, okay.
Yeah.
So now when you talked about using soft to medium types of brushes, and there are these people that have this contingency to listen, no, we have to use medium to hard or just hard. Now the question is, why do we use soft to medium, and is brushing hard or rigorously is actually
excellent
required?
question. I've seen a lot of patients who thinks the same. So they think that they need a strong toothbrush, and the way they're brushing their teeth is like they're getting their revenge from their teeth. So they keep brushing their teeth so hard to the point where you can see some wear over the tooth. So the reason why we don't recommend a hard toothbrush is because we want to keep those teeth unaffected by the wear effect of the abrasion, of the bristles against the tooth surface. So that's why we recommend to have a soft bristles in your toothbrush and not to brush so hard. So the concept is to get the bristles in contact with the toothbrush, is not to remove a layer from the tooth surface. So that's why we always recommend to have a soft tooth bristle.
And removing part, let's say the protective layer in tooth will cause enamel problems, sensitivity, and
we don't want, yes. So when you have a strong brushing technique and use a strong or medium bristles, what you'll have is what we call as abrasion. Okay. So you will remove that enamel layer which protects the tooth against sensitivity and against the microbes inside the mouth.
All right. So for your experience, what are the most overlooked steps in daily oral hygiene habits?
So as we said before, brushing for 2 minutes. Almost like 70 or 60% of my patients didn't know that they need to brush for about 2 minutes.
Oh.
Again, using a soft toothbrush is better than medium and hard. Mouthwash is something that is good, but I always recommend to use a alcohol-free mouthwash, is because you want to keep the mouth hydrated, and the alcohol inside the mouthwash gives you a dry mouth, and you know, saliva is very important. That can protect you against caries and microbes inside the mouth. Again, going back to dry mouth, you need to keep hydrated. You need to drink water all day and stay away from sugary and juicy drinks.
Of course.
Because all these will cause for you what we call is erosion. We talked about abrasion, which is a mechanical loss of tooth surface, but erosion is chemical loss of the tooth surface that is caused by the low pH of the soda drinks and sugary and fruity juices.
Is there other techniques that, other than actually brushing hard, that people think that if they do it on a daily basis, it's not harmful, but on a long term, it will turn into something harmful?
Well, again, so brushing is one of the most things, brushing hard is one of the most things that can cause tooth wear. Also, some people like to place material inside, between their teeth, like, you know, toothpicks. Or I'm against toothpick, by the way. I don't like people using wooden toothpick. Whenever you want to remove food debris between your teeth, use a dental floss, because the reason why toothpick is very dangerous, because you're not experienced. Sometimes you can injure your gum and introduce new bacteria inside the gum, which causes a dental disease and gum disease for you.
All right. So how important is timing, like brushing before breakfast versus after?
Oh, amazing. So as we said, whenever you eat, now there is a change in the pH inside your mouth. So do you remember those commercials where you take a gum and it neutralizes the pH, which is true. Bacteria, or let's say microorganism, that is part of your saliva, by the way. There are a lot of studies about microorganism in the human saliva, and they found that you have millions of different types of bacteria inside the human mouth. So whenever you have sugary food, whenever you have soda, whenever you have something that reduces your pH, you will have an environment which is very rich for the bacteria to live in.
Our residents in the tooth, as they call it.
It's like heaven for them. So they will thrive and they will cause dental caries. So if whenever you have a sugary or a soda, you should wait for about 30 minutes before starting to brush your teeth. You don't want to take that acid and disturb it all over your teeth. And again, if you want to feel fresh and all that, you can rinse your mouth with water to neutralize the pH inside the mouth, of which then you can get rid of the acid.
All right. Very interesting topic. How about we take a short break and we'll be right back, Doctor?
Yeah, sure thing.
All right, dear viewers, a short break. Don't go away. Stay tuned. And we're back, dear viewers, after that short break, and let's continue our topic with Dr. Abdullah about oral habits. So, doctor, how do diet and daily choices shape the long-term health of our teeth?
As we said earlier, diet has a very direct effect on your oral health.
True.
So, acidic drinks and sugary food can always affect, as we said before, can always affect the health of your teeth. So a person who drinks a lot of energy drinks, a person who starts his morning routine with 2 or 3 orange juices will have a high acidic environment. And we've mentioned that this environment will allow the bacteria to thrive inside the mouth, will allow them to attach on the tooth surface and to cause what we call cavity.
Okay.
And eventually, you know, getting your tooth gets a filling or root canal.
So acid, whether it's from a drink that is industrialized made or natural, acid is acid. In the end of the day,
acid is acid. Acid is acid, and we're not against juices. We're not against coffee. We're not against tea. We're against the pH.
Oh, okay.
And anything, as we've learned that it's fine to enjoy those drinks. It's fine to enjoy 1 or 2 cups of coffee, 1 or 2 cups of tea. But the effect will start when you have lots of coffee, lots of tea all over the day, and just neglecting the importance of having a glass of water and to get this acid effect away from inside the mouth.
Rinsed out. So how does nighttime routine differ from a morning routine?
Okay, so at nighttime when you sleep, it's proved in science that you will have less secretion of saliva.
True.
And saliva is, as we said, it's full of microorganisms, but again, it's full of enzymes and proteins that will fight these microorganisms. So whenever you sleep and there is a decrease in the saliva secretion during night, you are vulnerable to the microorganism to habit the surfaces of your tooth and then start causing cavities.
Especially when it's a very long hour that you sleep, which is 7 to 8 hours.
And I'm sure when I say this, a lot of people will wake up in the morning and they will feel there is a layer of white, a white layer that is covering their teeth. And nobody, I mean, I can explain it for you now, but they don't know where did it come from. It's actually from the bacteria community. They colonize the tooth surface and they form this white layer over your tooth. And if you neglect removing this layer, it will become what we call calculus. And then you will have dental cavities and halitosis and so on.
Oh, all right. So do you see any pattern between people's lifestyle habits and the conditions you treat in your profession?
Yeah, well, you can see that when it comes to pattern, if someone who is taking care of his diet, like for example, an athletic person, you rarely find an athletic person with lots of cavities. It's because he takes care of his diet.
True.
When you find other people who just like enjoy food, I enjoy food by the way, you will find they will have more cavities, especially when you neglect the importance of brushing your teeth and using the floss and mouthwash.
It's kind of a sad story that since I also am a foodie, it's kind of hard to always keep up with flossing and brushing and brushing and flossing.
Well, you don't need to do that all over the day.
Yeah.
You need to do it just twice a day. Once every morning is good, twice is better, 3 times is amazing.
All right. So, doctor, tell us a little bit about sleep routine with the dryness and also mouth breathing. How does it actually affect the health?
So, yes, mouth breathers, they will have more dry mouth.
Okay.
And again, going back to the same concept. So, if you're a mouth breather, you will be more susceptible to having a dry mouth. And again, people with dry mouth, they have more cavities, they will need more filling, they will need to have more dental checkups than a person who sleeps normally and breathes normally. So if you have a dry mouth, what I would recommend is that you drink a lot of water before sleeping. Okay. That's one thing. I like to prescribe chewing gum, sugar-free chewing gum, for anyone who is suffering from dry mouth or anyone who's is a mouth breather. It's just to stimulate the saliva secretion inside the mouth. And again, if you want to go to sleep, sleeping routine, if you want to go to sleep and you brush your teeth, and I say this to every teenager who comes to my clinic, whenever you brush your teeth, now you don't take any sugary food. Don't eat dinner after brushing your teeth. It's because you're getting your pH back to an acidic level.
True.
So if you brush your teeth and you felt like you want to take a sandwich again or to drink some soda, wait for 30-40 minutes, brush your teeth again, and then go back to sleep.
Now, let's talk about, let's pivot in another way. Genetics.
Yeah.
People with the specific genetics maybe have a very good oral mouth hygiene, or basically they have stronger teeth. Do they have a free ticket not to take care of their teeth?
Of course not, but you know, genetics can go both ways actually. Okay. So you will find people with strong enamel that is, and I've seen it in my clinic. I've seen a lot of people who they don't brush their teeth, they don't do any scaling, and there is minimal amount of plaque, minimal amount of calculus. Again, it's because of genetics, it's because of the composition of their saliva. Oh, yeah. And I've seen a lot of patients where they come for a routine checkup, but I think it's more likely to go with the daily habits. It's not scientifically proven, but again, it's more likely to go to the daily habits. And as I said, genetics can go both ways. So, and I've seen people with specific dental conditions that is related to genetics, like dental fluorosis or like amelogenesis imperfecta. These are dentinogenesis imperfecta. These are conditions of which the tooth becomes more susceptible to caries than a normal health condition.
But doesn't that degrade with age?
It degrades, yeah, but I mean, like for example, going to amelogenesis imperfecta, which means it's there is a defect in the gene that is responsible for the production of the
secretion in the saliva.
No, not the secretion of saliva. Not the dentine. The enamel.
Enamel stuff. Okay,
I don't know how did it get. All right. Okay, so it's the gene that is responsible for the secretion of enamel. So you will find this enamel, which is the protective layer for the tooth, becomes defective, and the tooth is more susceptible to caries. Usually they get a lot of root canal treatments in their teeth. Also the dentinogenesis imperfecta, they will have a lot of caries and root canal. So again, genetics can go both ways. Yeah.
All right, how about we take another break and we'll be right back for more, doctor.
Sure.
All right, dear viewers, another break and we'll be right back right after this, so don't go away. All right, dear viewers, and we're back again after that short break. So, doctor, what's one daily reset you recommend to improving oral health immediately?
So, to improve the oral health immediately, I would recommend that you hydrate a lot over the day. You need to do flossing and and dental brushing. And finally, if you feel like you have a bad breath, or you feel like you need to freshen up, use a mouthwash.
All right. So usually mornings are very difficult for people. Like they're always waking up lazy. They don't know if they're going to look for coffee or brush their teeth or get dressed.
Yeah.
But when it has to do with oral habits, what is something that you can tell people, advise them to use on a daily basis to make it more easier for them?
So if you're very lazy, get a electronic toothbrush.
That's one.
That has a timer for 2 minutes to brush your teeth for 2 minutes. And whenever you wake up, start with flossing, followed by brushing your teeth for 2 minutes, then wait for 20 to 30 minutes. If you feel like using a mouthwash, use a mouthwash after 30 minutes.
All right. And how long does if we start using electric toothbrushes, does it actually cut the stress and the time dramatically?
Well, it won't cut the time, but will cut the stress and the attention that you need to time your brushing technique.
Okay, so it'll be kind of more convenient.
So what I do is usually I walk around the house whenever I brush my teeth. I go to the kitchen, prepare my coffee, prepare my tea, whatever I'm having at that morning. Yeah. And I don't keep counting. I mean, the toothbrush does it for me.
Yeah. All right. So how can someone structure? What's one small habit that dramatically improves gum health?
Hydration, of course, and brushing your teeth.
Now, there's a question I forgot to ask you. What is a plaque and how does it form? Now that we're talking about like advices, how can we actually not form plaques as much as we can?
So a plaque usually it appears as a layer, a white layer over the teeth. So how it shows is by the microorganisms inside the mouth. They unite all together. So it takes about 6 to 8 hours for these microorganisms to unite and form that white layer. So, and usually it happens because of the dryness of the mouth. So in order to prevent plaque from having plaque is to brush your teeth first thing in the morning. Okay. To keep hydrated, like drink water before sleeping, and chewing gum all over the day will stimulate the saliva, and it will prevent the plaque from forming over the teeth.
And of course, night brushing, which is also important.
Night brushing is very important, of course. Yeah.
So how often should people actually replace their toothbrush?
I get this question a lot. So usually it takes about 2 to 3 months, but it's not about time, because I tell my patients to replace their toothbrush like after 2 or 3 months, but he doesn't brush his teeth. Like he brushes his teeth for once every day or once every 2 days. So there are signs. Whenever you see these signs on your toothbrush, you need to change them immediately. So whenever you feel that the bristles are bending or like they're worn off, it's a sign for you to go to the supermarket, get a new toothbrush.
All right. As your per experience with different patients, what is the most memorable one that you have that you actually changed their life in?
Well, since you mentioned this, I got this patient. She was pregnant in the 6th or the 7th month. So it was in the 3rd trimester. She was in deep pain. Nobody wanted to treat her because she was pregnant. I did root canal treatment for her. And I saw this patient 2 years back. I was in a mall, one of the malls in Kuwait. And when she saw me, she came and ran to me and said hello to me. And she showed me her boy, and she called that boy Abdullah. So I was very happy.
That's very awesome. Yeah. That's a very beautiful story.
Yeah.
So what do you wish every person would start doing today to protect their teeth for a long term?
Well, as you said, keep hydrated, floss, use a toothbrush, brush 2 or 3 times a day, and this way you will keep the dentist away.
Dentist away.
Yeah.
You've mentioned the fact that there are specific fruits that are kind of hurtful for the teeth. Not hurtful, but having it a lot will hurt it because of the acidic part of it.
Well, let me. Yeah. A lot of my patients thinks that coffee stains teeth more than tea, for example, which is the opposite around. Yes. So coffee doesn't stain teeth as tea does. Now, there is a compound that is in tea called tannins, and this compound, which is a natural compound, by the way. So this compound, it allows the hue from the different food to stay on tooth, and usually you find this compound in black tea. Okay. So I'm not advising any person not to drink tea. Actually, go ahead, drink tea, because tea is again, it's full of fluoride, which is amazing for our teeth and helps to protect our teeth from caries. But doing it too much, this is where the harmful effect comes from. So, like for example, tea is more harmful than coffee, but coffee again is very acidic.
Very true.
So
okay, you need to find the balance.
You need to find the balance in your life. A good advice if you love to drink tea or coffee, whenever you drink tea or coffee, after you finish, drink some water, and this way you will neutralize the pH inside.
Now, a follow-up question about that: is there specific fruits or vegetables that actually help with the teeth in the side of like make it more stronger or put a protective layer or whiten it?
There are a lot of food that have that contains fluoride inside them, which is amazing for our teeth to protect against caries. But again, going to any fruity citric fruit,
pineapple,
that is sugary,
and,
yes, all
orange.
these they contain sugar and acids. So again, doing them a lot will have their mark on your teeth, and so you need to be careful when consuming.
They always say like an apple a day keeps the doctor away.
Well, an apple a day will keep a doctor away, but 4 or 5 apples a day will bring the doctor to you.
Exactly. So, doctor, tongue scrapers, how important is it? And is it actually effective in some way?
Well, they are important. I would call them auxiliary tools. So they are like supplement to keep a very good oral hygiene. So I don't usually recommend it for a person who is not used to use a toothbrush. So my first priority is to get you to use your dental brush twice a day. So if you master this and master brushing your teeth, then yes, if you want something extra, yes, I would highly recommend that you go with the tongue scrapings, especially if someone who is suffering from what we call halitosis, or in common language, it's called bad breath.
Yeah.
So,
well, how does that actually start? How can you have a bad breath knowing that? Because I have some people that I know, I eat actually healthy and I'm okay with everything, but yet I still have bad breath.
Well, there are too many causes for bad breath. There are what we call intrinsic causes. So it's something like comes from inside the stomach that you don't have to do anything with it. So you need to see a physician to see you and get you something to get rid of it. So for example, people or a patient who is suffering from diabetes will have some odor from his mouth that is concerned with the disease itself. It's not concerned with any dental or oral habits. But so if we want to go to the dental causes, of course, not getting rid of the food debris that is stuck between teeth and not getting rid of them by brushing or by flossing. Again,
if anything, brushing will push it in.
Of course, whenever you get rid of that food between your teeth, the bad mouth effect or the odor will ease. So again, if you have bad prosthesis, again, of which food particles will get stuck in between them, again, you will have halitosis. So you need to get these prostheses done.
Got you, doctor. Hey, thank you so much for being here, actually, and it's been a wonderful topic talking with you.
Thank you for having me.
Thank you, doctor, and hope to see you soon again.
Thank you.
All right, dear viewers, we've reached the end of today's episode right here at Daily Reset. I hope you actually had an informative information about dental oral hygiene and habits, and start taking these steps and advices more seriously, because in the end of the day, I'm sure everyone wants to have a beautiful smile. Until then, see you soon.